The American Academy of Facial Aesthetics is an educational organization that really brings the best training available when it comes to minimally invasive facial aesthetic procedures such as Botox and dermal fillers, as well as many other therapies that are out there.
What a student can expect is to be able to take this 2-day course and walk out with knowledge and skills and concepts and equipment where they can actually start this on Monday.
It's a 2-day course in most cases. The first day is a Botox course, and what we do is we have a lecture time, typically in the morning, and in the afternoon is a hands-on where the dentists, physicians bring their patients, and we work with them one-on-one on the proper injection techniques so that they're well-trained. They go back to their office for Botox. Day 2 is dermal filler, and it's the same scenario. Lecture in the morning, hands-on or patient training in the afternoon.
Students bring patients and we actually inject right then and there, and then the second day when we do the facial fillers, they can see the results on the patients.
Here you have a full comprehensive didactic portion in the morning and up to 3 or 4 models in the afternoon, and there is no better program.
I think it's a really well-trained faculty who are completely invested in this energy to properly train the doctors. But it's almost like our passion to train them so they go back to their office and actually have a skill set high enough to say, okay, staff, I'm going to treat you first, get a little more practice, watch my level 1 DVDs, and then within a month or so, you ought to be able to be treating your own patients maybe sooner, like 2 to 4 weeks.
With your membership, you have membership videos you can review, articles, you can write articles, do case presentations, you can email the experts and get answers. I mean, it's an ongoing process, and so you never feel like you're alone. The resources are amazing educationally.
Again, the strength and the quality of education that we offer in our courses, but then the ongoing support with the AAFE membership and the web resources, it really is tremendous.
When you really look at what we're doing, it goes right into dentistry and what we're trying to do with smiles, and this fits right in as a piece of the puzzle.
The Botox and dermal filler concept works extraordinarily well because I'm not only taking care of their function and restoring their dentition, but I'm also dealing with oral aesthetics, the smile, and now I can also do the total facial aesthetics. So it all fits into a package that has evolved over time to provide for my patient what they need, what they're looking for, in their best possible form.
When I looked at Botox, I never realized there were so many uses therapeutically for it.
My patients come in on a regular basis and just want to get out of pain, and all the techniques before that were either invasive or just didn't exist now can easily be done with Botox. I'll get bigger hugs and more tears from that than anything else.
Not only are there so many therapeutic uses, but the side benefit of the Botox is that it gives you a facial enhancement.
I can help my patients in a way that I couldn't help them before. I have a new tool in my toolbox. I have a new arrow in my quiver.
It's made my practice boom. Not for the reasons that you would think it would be, but because I have this extra service as a pain diagnostician. It lets me treat pain when it's not just dental. A lot of people are doing this now. Now's the time to get involved when it's just starting to take off. You have your best opportunities right now.
It's been a great experience. The lectures have been interesting. The material is interesting but still direct. And they've been able to take a lot of information and boil it down to 2 days and then present a hands-on portion.
These are really thorough courses, very thorough. The lectures are really good. The materials they give you are up to date and thorough, easy to follow.
It's really the missing link for what we do in terms of, our practice is focused mainly on cosmetics. Who better is qualified than the dentist to kind of take care of things in this region? So it's really the missing link, in my opinion, for finishing. It's like case finishing is what I call it, It's a really nice finish. Whenever you can make something easy for someone and say, hey, Botox and cleaning at the same time, that you're adding value to someone's life by actually making it easy, right? So you can almost put it on the same kind of schedule almost for women, and they love that idea.
We now have the tools that we need and the skills that we need to go back on Monday and deliver this for our patients.
This is a life learning experience that literally can change the way a practice goes ahead and delivers its services to its patients.